So you treat sleep apnea. People that literally have to use a CPAP now have an option, another option. Tell me
Yes,
about
absolutely. You know, sleep apnea has been treated for many years, but there's a collaboration between medical doctors, primary care physicians, or sleep doctors with dentists.
that. Okay.
This is new for the last 5 years or so. I've seen more and more dentists are getting involved with sleep apnea, including myself.
Okay.
What it does for patients, I've treated quite a few patients in my practice. They get up with, they usually get up happier, they had a good night's sleep, their depression or bad mood for that day can go away, and they're not sleeping away in a couple of bedrooms away from their wife or spouse are not kicking them out.
And this is for chronic snoring or sleep apnea?
Yes, because I noticed I've had wives or spouses call me and say, please help my husband. I saw him get up and he was choking. I was afraid he was going to die.
Wow, okay.
And I got him back. And, and most people, I have a beard, most men who have beard and facial hair, God, I mean, CPAP, you can't even put that mask on you,
But
it
CPAP
scratches.
works.
It does work. That's a primary line of treatment by physicians. But you know how many patients are actually wearing 50%, or maybe slightly less than 50% of patients who have CPAP masks are actually wearing it.
So they get it and can't wear it.
Yeah, if you can't wear it, you're not even treating it.
Then it doesn't work.
But you know what the rate of Randy is for the appliances that help you sleep better? And it's in lieu of the CPAP or BiPAP mask. It's 73%.
They use it.
They use it. They can use more patients.
These people are breathing just fine throughout the day, but they lay down and what's happening that's blocking their airway?
But what happens is when we sleep, we're in a state of paralysis. Our muscles become paralyzed. The only thing that doesn't become paralyzed is the diaphragm, the lung, because you got to breathe, right? So what would happen? These are all our jaw, our bones are held by muscles. So what would happen when you sleep and you're really in a deep sleep? Especially if you're livid, have a bigger neck, what would happen? This jaw falls back. If you have tonsils, young men and women who have tonsils, the tonsils prevent breathing. And even the air that goes through your nose, it gets trapped right in here, doesn't go to your heart.
So then what do you do as a dentist?
Well, what we do is we make these appliances removable that you put in your mouth. It keeps the jaw forward, holds it forward.
So it opens up the airway.
It opens up. Now all of a sudden more air goes to your lung and your heart, and you can sleep better, and the snoring goes away.
So you do sleep tests and you say that people are waking up like 20 times in an hour and they don't even know it.
Oh, absolutely. As a dentist, I cannot diagnose, but I can screen. Actually, American Dental Association says that every dentist needs to screen every patient for sleep apnea. Did you know that, Randy? Yeah, it's a new thing. I mean, we got to do that. I have a questionnaire. It's a 2-part questionnaire that I give to every patient, and sometimes I have for bed partner. Bed partner, someone who sleeps next to the patient. Yeah. They need to fill that out. I get a report from the wife says, "Listen, you got to help my husband. I thought he was going to die. For about 20 seconds, he was not breathing. I didn't see the chest up and down. Didn't go. It was not, moving." It's scary for a spouse.
Like when they go to a medical doctor and get a sleep test, they are waking up throughout the night.
Yes, they're waking up and they have all that, yes.
But they don't even know they're awake. I mean, they wake up tired.
They wake up tired. It affects the memory.
Okay.
That's why they have to have 2-3 coffees a day.
So you open up their airway. How soon does it start working? Where they go, wow.
Immediately. You got to bring that jaw forward and the air gets into the lung. And the air from the lung now goes to the heart. The blood carries the oxygenated oxygen,
Okay. Who's happier, the partner or the person actually getting it done?
I think the partner.
Because no more snoring.
No more snoring. I get so many success stories from the partner. It's beautiful.